So at Logan Regional Hospital, we've started implementing tiered escalation huddles as part of the Intermountain Continuous Improvement method. And we've had great success implementing this process. We've been able to identify and resolve a number of both operational and safety concerns that affect our patients and our employees by using the error prevention techniques that we've learned through our zero harm training. So the great thing about these tiered escalation huddles is they really can be used anywhere within Intermountain. They're there to help escalate and resolve concerns no matter where they exist in the organization, and we've really seen a lot of success with them here. Tiered escalation huddles follow a 5-step process that begins with Tier 1, each manager's daily huddle with their frontline staff. Managers meet with staff to discuss employee or patient safety concerns, medication errors, staffing concerns, equipment downtimes, really anything significant that should be escalated to the director for action and communication. Here's what a Tier 1 huddle looks like.
Does anybody have a safety moment they'd like to share this morning?
I do have one.
Yeah, Flo.
So we had a really good catch situation where Lindy, she used the stop and resolve technique. They were doing the final sponge count when she realizes that one of the sponges was missing a piece. And so she stopped and compared that sponge to a new sponge. And in fact, it was missing a piece. So she escalated it to the physician. They went in, found the piece, removed it. Lindy really saved that patient a lot of problems.
Well, thanks so much for bringing that to our attention. I think that's a great
This
way.
is also where caregivers and staff can introduce safety issues that need to be resolved.
Does anybody have anything else they'd like to share this morning?
I'd like to bring up something I noticed yesterday. I was checking a set of instruments that just came out of the sterilization autoclave and thought it would be a good idea to double check them to make sure they were sterile. The test result I got back indicated there were contaminants present. Luckily, I was able to catch it before it went to the OR, but it still concerned me that we don't have a double check in place at that stage of the process. How can we make that happen?
Thanks, Dave, for bringing that to our attention. I think that's probably something that we would like to go ahead and take to our escalation huddle.
If this issue cannot be resolved by the manager, it is then taken to Tier 2, or the director level. Outside of safety events, this could include HR or contract approvals, open event reports, IT or supply issues, or other high priority issues. If the director cannot resolve the issue at this level, it is taken to Tier 3 and presented to the operations officer.
Do we have any good catches today from anybody?
From that point, concerns that still cannot be resolved will be taken to Tier 4, which involves the facility's administrative team. Start us off, if you have any good catches to report.
I do. I had one good catch today in the endoscopy.
And finally, issues that cannot be resolved there are taken to Tier 5 and presented to the regional vice president for resolution. And they were able to catch those and stop those instruments from going up to the OR.
Kyle, thank you. That's a great example of stop and resolve. Will you please let David know how much we appreciate the fact that he's practicing these zero harm techniques that keep our patients safe? That's really important. Bonnie, do you know what's going on in terms of making sure that we spread this knowledge to other areas? What's the action?
I'll actually go with all the surgical services directors for our region to ensure we have all of that. So Kyle, let me know if Kim knows about this. She probably has more detail. But let's get with them and we'll spread this out, because if we change the process, we want to make sure we're all consistent with it. And then we'll make sure that after we do this, that we forward it on to our clinical program leads.
Once a concern has been addressed, that information is passed back through the system to the originating source, thus closing the loop. So the great thing about this process is that not all problems need to go up to the Tier 5 level to be solved. Many of the problems that we identify in our huddles can be solved at the Tier 1 or the Tier 2 level, and that's really the whole idea, is to be able to solve the problems at the appropriate level. So these tiered escalation huddles really are a powerful tool for Intermountain Healthcare. And from the patient's perspective, it's really powerful to be able to have a process where issues and concerns are being escalated in a timely manner every day. So at every level, tiered escalation huddles really help our leaders to be accountable and to identify opportunities for improvement.